I'd like to welcome you today to the Gold Coast Plastic Surgery Podcast. I'm Dr. Mark Doyle. I'm a specialist plastic surgeon and I have more than 30 years experience. Today I have with me Kirsten, who is our inquiries advisor, and between us we're going to cover several different topics throughout the course of the podcast.
So today I would love to talk to you a little bit about breast surgery, and I know there's different types of breast surgery, but I want to start with breast augmentation and touch on breastfeeding. I receive inquiries from patients and they want to know, can I breastfeed after having an augmentation?
All right. Breastfeeding is a difficult discussion because there are a lot of ladies that without implants can or can't breastfeed. And it's very difficult to know, particularly if a lady hasn't had any children in the past, whether she's going to be a successful breastfeeder or not. Adding implants into the combination is really difficult to make a decision whether it's the implants that's causing a problem or whether it's the fact that she wouldn't have been able to breastfeed anyway. The implants can be placed in different positions in the breast or in the chest wall, and it's important that there is, with the implants being in different positions, it will potentially change the breastfeeding ability of the lady involved.
So if an implant is placed under the muscle, will that change the way or affect the way that they might be able to breastfeed?
Under the muscle, the breast implant doesn't really touch the breast tissue itself, and when it goes in, the breast tissue and the breast ducts aren't at risk of being damaged in any way, so the risk of them not being able to breastfeed is very, very low.
Okay.
Implants above the muscle are still below the breast, so the breast implants don't ever sit inside the breast tissue. So above the muscle, again, the risk of causing any damage to the breast tissue or the milk ducts is extremely low, and breastfeeding shouldn't be affected by the position of the implant below the breast. The more important thing to think about is how the implants are put in.
Now I know that there's a few different ways that you can actually insert the implant.
There is. So if we put them in through the armpit, because the implants are going through usually underneath the muscle at that stage, the implants aren't anywhere near the breast tissue, and there's no incisions anywhere near the milk ducts, which come out from the nipple and go down into the breast, the chances of interfering with breastfeeding is extremely low. If the implants are put in through a cut in the breast fold, again, the implants aren't anywhere near the milk ducts, which is around the nipple, so therefore the risk of having problems with breastfeeding is very low.
Right.
If the implants are put in through the areola or the pink area around the nipple, that's where the milk ducts are, and that's where there's a risk that damage to milk ducts there can affect the breastfeeding. So of all the different options, it's more important to think about not so much the position of the implant, but the position of the scar that's involved in putting the implant in.
That makes sense.
So my advice is, if anybody's considering breastfeeding, it's a very important part of the process for them. Stay clear of anything that has a scar anywhere near the nipple and therefore the milk ducts.
Okay, that's great information. Thank you so much.
The other thing I would like to say is that the other part of the equation is that with breastfeeding, it's important that for the baby to get the milk to start to flow, it has to suck on the nipple, and the nipple has to have sensation. So that a breast with a nipple with no sensation may have problems with breastfeeding as well. And again, that would make me say keep away from those scars that are around the outside of the areola, as there is a potential that there can be some changes in nipple sensation, and if a nipple sensation goes down, it may make it more difficult for breastfeeding.
Well, thank you so much. I'm sure that answers a lot of questions for people who are considering breast surgery and breastfeeding.
You're very welcome.